Hi, everyone. I'm here to talk to you a little bit about patient advisors. I know some of you are at different levels of care and abilities with your PFACs and patient advisors, but I hope that everyone can find something that helps them in this presentation. So last month, we talked about patient advisors and recommended that they come from the community. So where would you find these people? So if you look at hospital surveys that a lot of you already send out, there's usually a little comment box that says, contact me for more information, or someone is interested in being recontacted. Follow up with those people. You can see that they already are interested in sharing their opinions. If their story speaks to you, then they might be a great resource. Make sure that they have had enough time pass from their event, though, that they're not going to be re-traumatized. Mom and parent groups are also great resources. Sometimes they're at the hospital, sometimes they're at local organizations like libraries. Um, a lot of PFACs have had great success finding their advisors there. You can always ask providers or nurses if they have a patient that they'd like to recommend. Word of mouth of your current advisors. If you have an up and running PFAC, sometimes they have friends who they would like to invite. Sometimes someone with a event in their life will find other friends who had similar things and they'd like to share their stories as well. Social media posts sound like they wouldn't be very productive, but they actually are. I posted on my own social media and people responded to just my own little post that they'd like to join a PFAC. So an engaging post from the hospital might actually work. Community events like community baby showers have been proven by other PFACs to be really successful. You hand out some diapers, some information about babies, and have a booth where you talk about your own situation, your PFAC, and that you'd like their help. And once you find these people, please make sure that you've interviewed them and that they're far enough removed from their trauma that they're ready to participate and they're not going to be re-traumatized. So once you find these people, how do you onboard them? Um, as you guys know, working in hospitals, there's lots of paperwork. We just ask that you make it as accessible and short as possible. Try not to include too many legal documents in your paperwork, only what is truly necessary and as understandable as possible to the average person. Once it becomes too long and there's too much paperwork, a lot of applicants will say it's not worth it, they'll quit. If you want a lot of different perspectives, make it as accessible as possible. Once you have these documents in place, you can have a welcome meeting, either virtual or in person, to provide a welcome letter. You can also provide a welcome letter if you can't have a meeting, which will lay out the process and any of this paperwork that will be completed. Some people will need help completing the forms. That's why a meeting would be more beneficial because you can help them. Make the expectations clear. How much time is expected? How many meetings per week, per month? How many hours of extra work per week, per month is expected? And any work product goals. Um, as easy to understand as we try to make things, we know that it's still going to be confusing to some people. So we recommend that you have someone who works at the hospital. An RN or staff member is a great choice for this to serve as the PFAC connector or PFAC liaison. This will be the person to reach out to if your advisors have any concerns, someone to make them feel connected. They're also the person you're going to email for meeting links and questions, someone to let know if you can't attend. And it also never hurts to have a friendly face in the meetings. So if someone is shy and they feel like they don't have as much education or experience as everyone else in the room, they can look at their liaison or connector, and that person can make them feel at home and welcome. For meeting locations, there's the options of in your hospital, virtual or hybrid. If these are going to be in person, and if possible, allowed through your legal department, try to provide transportation funding like Uber gift cards or gas cards or childcare options or stipends for childcare. Virtual meetings would remove the need for these. We also recommend virtual and hybrid options because it could help the paperwork. Less paperwork if you're not in person. Maybe you don't need to fill out hand washing forms or as many HIPAA forms. Um, the less paperwork, the better. So if virtual or hybrid is going to help that, then that's great. They also would eliminate things like background checks or ID badges in some cases if you can do it online. It would accommodate as many work schedules as possible, support people with kids. It would help. alleviate the need for childcare and also allow for more time availability because of less travel time. Um, you want to meet often enough to feel productive, but not so much that you feel overwhelmed. Your staff works hard, your nurses work hard, and no one wants more meetings that are not productive. So you want to have the happy medium between productivity and um, not enough. You want to meet enough that you're making a difference, but not so much that everyone feels bogged down. Um, you want to try to vary your meeting times between afternoon, morning, and evening if possible. Online is good for that as well. If you always meet Mondays at noon and someone works Mondays at noon, they can't be on your PFAC. And their opinion might be really important and helpful. So, varying the times could open up a lot more advisor availability. Um, so, once you schedule all of that and you have all of that set up, you have all of your people in place, how do you keep them engaged and what do they do? So you want to keep your people engaged by providing small and important tasks, reviewing patient handouts for clarity, pointing out words and phrases that may be confusing, letting them suggest ways to make care feel more welcoming and respectful. You can cover facility upgrades. I saw one PFAC that allowed the members to come and try out the new beds for the hospital. I thought that was a really unique, cool way to use them. Um, you can have them talk about ER wait times and how those are communicated, visitor policies, discharge education, signage, new menus if they're vegetarian friendly or religiously respectful, communication tools, designing new areas, um, any other things to make the patient experience better. You can even talk about noise. One patient advisor shared with me that the little chime that plays every time someone gives birth was going off in her room after a loss. And it was very traumatizing to her to hear everyone else having a great day when she was having such a terrible one. So just turning down the volume of that in her room made all the difference and something that a lot of people wouldn't think of immediately. So once things start getting accomplished, you're meeting and you're discussing these things, provide follow-up information on how their suggestions are being implemented. People want to know that they're making an impact and that their work matters. So celebrate the little wins. Every suggestion and change could potentially make a difference in someone's care. An advanced practice on this would be a thank you dinner or thank you Zoom at the end of each year, thanking your members, um, and showing either videos or pictures or just a slideshow of different suggestions that have been implemented and how they've been helpful. Um, Other helpful hints for these meetings are medical terminology. Not everyone is a doctor, so you would want to provide as much terminology as possible. Um, and common acronyms as well. One of my experiences was that someone was talking about AWAN and I didn't know what that was. And I was trying to Google it during the meeting and I couldn't spell it because I didn't understand what she was saying. And I spent so much time thinking about what AWAN meant that I wasn't listening. So if I had a list of definitions and acronyms, I could have just looked at it and then felt more engaged during the meeting. You want everyone to feel equal and not less than. So if they all know what we're all talking about, then that's better. If your advisor is being quiet during the meetings, maybe they're shy, maybe they're intimidated, try to engage them in conversation or ask them what they think about different topics. If they're still not talking, offer to meet with them individually and see if they have something they want to add. As long as everyone's feeling like equals and feeling productive, hopefully your PFAC and advisors will feel good and there'll be a lot of positive change made. As always, my info's on the screen. I'm here to help. I can come and set up individual plans for you guys on virtual or in person if you're close. I'm happy to make plans for you guys that help your specific needs. Reach out. I'm here for you. Thank you.